First, let's understand what the prostate is. The prostate is a small, walnut-shaped gland found only in men. It sits just below the bladder and surrounds the urethra, which is the tube that carries urine from the bladder out of the body. The prostate's main role is to produce fluid that helps nourish and protect sperm, which is essential for fertility. But as men age, the prostate naturally gets larger. And in some men, it grows too much, pressing against the urethra and making it hard to urinate. That's when we call it benign prostatic hyperplasia, or BPH. So why does the prostate enlarge? One of the main reasons is hormonal changes. As men get older, their testosterone levels drop, but a hormone called DHT, or dihydrotestosterone, remains active. DHT triggers the prostate to grow. Then there's the aging process itself. BPH is very common after age 50. In fact, about half of men in their 50s will experience it. And that number climbs to 90% by their 80s. You're also more likely to develop BPH if it runs in your family. So if your father or brother had it, you might too. And finally, your lifestyle matters. A lack of exercise, a poor diet, or being overweight can increase your risk of developing BPH. Now let's talk about symptoms, the things you should never brush off. First, there's frequent urination, especially at night. You might find yourself waking up several times to go. Then there's a weak urine stream, or a delay before you can start urinating. You might also dribble after you think you're done, or feel like your bladder is never completely empty. And in severe cases, you might not be able to urinate at all, which is a medical emergency. If you notice any of these signs, it's time to pay attention. Getting a diagnosis for BPH is straightforward and important. Your doctor may start with a digital rectal exam. It's quick and can check for an enlarged prostate. They might run urine tests to rule out infections and do a PSA blood test to make sure it's not prostate cancer. In some cases, they may recommend ultrasound imaging or urodynamic testing to see how your bladder and urethra are working. So, how is BPH treated? Let's start with lifestyle changes. Reducing caffeine and alcohol, avoiding drinking too much at night, and trying a technique called double voiding, where you urinate, wait a few seconds, and try again, can help reduce symptoms. When lifestyle changes aren't enough, medications come into play. Alpha blockers, like tamsulosin, relax the muscles around the prostate and bladder to improve urine flow. 5-alpha reductase inhibitors, like finasteride, can actually shrink the prostate over time. In some cases, doctors use both medications together. For those who don't respond to medicine, there are minimally invasive procedures like urolift, resume therapy, or tuna that can ease symptoms without major surgery. And in severe cases, a common surgical treatment called TURP, or transurethral resection of the prostate, can remove the overgrown tissue and provide lasting relief. Want to support your prostate health naturally? There are plenty of helpful options. Eat foods rich in lycopene, like tomatoes and watermelon. Lycopene has antioxidant properties that may help keep the prostate healthy. Add more cruciferous vegetables like broccoli, cauliflower, and cabbage to your meals. Nuts and seeds are rich in zinc and selenium, two minerals known to support prostate function. Many men also use saw palmetto supplements, which some research suggests may help reduce mild BPH symptoms. And don't forget to stay active. Exercise can lower inflammation and support hormonal balance. So there you have it, the full picture of benign prostatic hyperplasia, or prostate enlargement. It's common, it's manageable, and you don't have to suffer in silence. If you're noticing symptoms, or if someone close to you is, talk to your doctor. Early detection can make all the difference. If you found this video helpful, hit that like button, subscribe to All About Health, and share it with your friends, your dad, your uncle. Every man deserves to understand his health. Drop a comment below if you have questions or want to share your experience. And don't forget, your health is your wealth. Stay healthy, stay strong, and we'll see you in the next video.